COVID was the fastest I have ever learned in my life. So we went from startup that was growing and coding some testing to overnight having to do 10,000 tests a day across the UK for kind of COVID antibody testing.
This is Tom Livesey, CTO and co-founder of Thriva, a health tech company that's raised over $11 million, served more than 2 million people, and delivered over 4 million tests. They're redefining how we track and improve our health span.
How did you get into health in the first place?
It was 2015. Elizabeth Holmes was plastered everywhere. The origin of why we started Thriva was actually one of my co-founders had a condition where he was kind of testing every 3 months to monitor it, and the kind of experience was really crap.
What's your piece of advice there? What would you advise people if they're fundraising?
The thing that we learned and the thing that we hopefully got better at over time was kind of
AI. What do you think is going to happen?
In my experience, at least, I haven't seen a lot of stuff that is super valuable and just like stuff that you really couldn't be done in the same way, like without in a different approach before. So I think we're going to have a few years of just.
So guys, I was just telling Tom that the first test I've ever done in the UK was a Thriva test. I got the first box and I didn't do it, and then I got another one, which is the one I did. So before all of these increasing companies doing blood tests and so on, so I think you're one of the first ones getting into this space. Just a small introduction. I believe you raised $11 million until now. Yep. And then you helped more than 2 million people and done more than 4 million tests. Is this accurate?
Probably, a fair bit more than that now. But yeah, it's about it. We've done a lot of work kind of both consumer and kind of with partners as well. So yeah.
Awesome. So take us back for a bit. How did you get into health in the first place?
Yeah. So let me paint the picture. It was 2015. Elizabeth Holmes was plastered everywhere. Blood testing was all the rage. But we actually kind of started just a bit before. We started a bit before that kind of all blew up. But really we were very early. So my background is I'm not clinical. I was like personally super interested in health. Like back then it was kind of quantified health was the term that everyone would use. And if you were tracking all this stuff and measuring ketones, it was a bit weird. And the origin of why we started Thriva was actually one of my co-founders had a condition where he was kind of testing every 3 months to monitor it. And the kind of experience was really crap, right? Have to take half a day off work, go sit in the waiting room, get a big needle in his arm. Like none of that is pleasant or fun, but you get on with it. But the worst part for him was that he didn't get his data. He had no idea. Like he'd hear that, no news is good news. I hope like you're all off fine. Like you don't need your results. And it got us thinking a lot about like how disempowering that is and like how actually no one cares more about your health than you. There's lots of systems in place to kind of help you, but ultimately you're the one that kind of is in most control and the most cares about it. And we wanted to change that. And at the time, remote kind of diagnostics, blood testing was obviously a thing, but blood testing is a very blunt tool. And like, it'd be really interesting to talk about like how we think about it slightly differently. But we just wanted to prove like, are we crazy? First of all, is this a thing? Because again, like at that time, no labs were doing this. Like there wasn't kind of all the testing companies that exist now. So we worked with some labs, a kind of known lab in London. And that was one of the things that we wanted to do differently right from the beginning is like, we're not trying to be a lab. We're not trying to develop testing hardware. We're going to use like accredited, tried and true stuff, but kind of build a digital kind of layer and user experience on top of that is way better. And so that's kind of how we started, proving that we weren't crazy and that people would bleed into a tube at home and send it through the post and get some results and hopefully take some action on the back of that. And really kind of that's obviously evolved a lot. And the way we think about Thriva today is, why we exist is to improve the amount of time people spend in good health. So we're really focused on health span, not lifespan, which is kind of really, really important for us. And the way we do that is kind of 3 different ways. So one, data, that's, the first thing you need is like, you can't improve what you don't measure. And so allowing people to get the lowest kind of most accurate, most reliable clinical grade data about themselves from inside their bodies on a regular basis is really important. And then bringing other data sources in, like kind of wearable data is something we've been working with Terran recently, to kind of layer on top of that and make kind of use of that. And then the second is data is just data. Like you have to understand it and make that useful. So turning that into insights, and we do that through kind of getting a personalized GP report. We kind of use a lot of data tooling so we can kind of help you benchmark against people like you, understand where your results sit. personalized advice on the back of that. And the last part is kind of taking that support further. So how can a Thriva actually help people make changes that impacts their health in a positive way over time? And a lot of what we think about is those feedback loops. So kind of understand, like get a bit of data, understand it, understand what you should be doing about it, do something about it, and then see kind of what happens and just trying to make that as quick as possible. Because really, if you think about it, I don't know who here knows what their HbA1c is at the moment. Good. Right. But like, yeah, it's kind of crazy, right? Like who here knows like their car, if you own a car, has millions of sensors that are showing you every second, like every single thing. You know way more about your car than you do around your own body. And so what we want to do is help people get that data more regularly, which is really important, understand it and do something about it.
And we go back to this founding story, like there is so many people thinking about companies, starting companies, right? And how did you create this first product? What did it look like? How did you make the first bit of it?
Yeah, so we started off, as I said, so we kind of worked with a lab and we convinced them to, I think it's quite funny looking back on it. They were a huge lab. They processed millions of tests for lots of people in the UK. And I remember sitting in there being like, are you know, we're really going to get going with this. Are you sure you can handle the volume? And they're like, I think we'll be all right. Looking at these three guys, have no product and had no plan for kind of how to grow. But you know, a lot of it early was quite scrappy. We rented a shed behind a huckle tree and like packed the kits ourselves. And like we were working in a co-working space and like obviously we had to send out kits and everyone in the co-working space knew exactly how well we were doing because it depended on the sack we were carrying up to like Old Street Roundabout, like post office that day. So it was like, and so as I say, like step one was like prove we're not crazy. Like will people actually do this? Because you know now I think most people, especially post COVID, will consider it's a given. Not everyone wants to do it, but people are willing to kind of do tests at home. But then it was like, yeah, step one, prove we're not crazy. Can we get this data into people's hands? And it took a long time. And, you know, the world was a very different place 10 years ago. The market was just not where it is today. So it was scrappy and it was kind of lots of experimentation. But it was great fun.
And how did the product change over time? Before we go into the B2B angle as well, like how did the product evolution happen?
I guess from the kind of part of what we expanded over time from a testing point of view, if you think about the kind of testing part of the product, was just expanding the range of biomarkers available. And that's really important, but it's not easy. Actually, you know, what you have to do to offer this on capillary, because it was a kind of different type of test, it wasn't venous, was go through validation processes. You can't just kind of like run the same test on a capillary sample as you could with a venous one on the same analyzer. So let's go through the validation, work with the labs to kind of make sure these were accurate and valid and kind of had the data for that. So that was kind of what we kind of expanded on first. And then I think once we had that, we got to a point where we had too many things that you could test that you couldn't do it in one test. And so we're like, okay, well, how do we help people identify what is the most relevant and useful things for them to kind of test it? And that might change over time. So we built kind of recommendations engines that were kind of like taking like data, make recommendations about what you should be tracking, help people kind of personalize their testing plan over time. And that was the kind of really important part as well. Again, day one, we were just trying to prove we weren't crazy, but then we realized this needs to be a subscription product. Like the value in this is from doing this over time. And that was a big learning for us, and that kind of really has influenced everything we do in the product from day one. If you think, I kind of talked about blood testing being a very blunt tool, like typically historically a blood test has been almost a way for a kind of clinician to confirm a hypothesis. So you might think someone has maybe this disease, I'm going to run a test to try and confirm my hypothesis. And usually if they're right, like this thing will be very high or like very low or kind of like, you know, far from the normal. What it wasn't kind of built for was to really kind of understand in a longitudinal way how these things were changing over time and what that meant. And so lots of things like the reference ranges, so kind of where your result sits within the thing, was genuinely like if you go to your GP today for some tests, those ranges are based on 40 people from the civil service in the 80s. Took a test, take the average, 2 standard deviations, there you go. And that's what it is today. Which again, kind of makes sense, is all right, maybe for that use case where, you know, you're trying to kind of diagnose something. But in terms of for healthy people tracking and looking to improve, it just wasn't good enough. So again, the next evolution was the product of how can we personalize that further. We worked with our amazing clinical team to build a set of proprietary optimal ranges based on kind of evidence for all-cause mortality. So basically, what is your level that is going to be cause you the least chance of dying over the next kind of 40 years. And that was really important as well. So people kind of, just sitting in a really wide band and being like, okay, well, I guess I'm normal is not that useful. Kind of, you can't do much about that. Helping people understand where they should sit and, what's optimal for them was really important.
On the subscription bit, what's the optimal rate for subscriptions? How should I get just people? How often should they?
Personally, I mean, I would do it every day if it was, if I wouldn't end up as a pincushion, but, we recommend every 3 months. Kind of typically our customers tend, to test between 3 and 6. The average is kind of every 4 months. And a lot of that is kind of cost and operational driven, which is obviously kind of makes sense, but really genuinely, like, this data would be useful to have daily. Like, if there was a wearable or ingestible or something that you can kind of get the stuff, it would just make everything more useful and more accurate. I think that kind of, how often you're sampling the data is just so important for these kind of things. And I think, again, a common misconception, I think probably, lots of people hold, and there's no reason you shouldn't, is that kind of this stuff doesn't change that often. It's maybe, if I do a test, it's not really going to change in 6 months or a year, or this stuff's changing all the time. Like, I've done a lot of personal experimentation both ways, like making it through experimentation at the moment, trying to make everything worse. I'm hopefully going to make it better soon. And you can really have an influence over these things, kind of like, which is great, right? That's empowering. People can be doing stuff, and all the stuff we test are things that you can have a positive impact on in a short space of time, certainly within 3 months, most of the time kind of sooner.
On the health insights bit, what have you find to be useful for people?
So we test a lot of different things. I think a lot of the things that people immediately come to think about are kind of risk factors. So a lot of the time people come to us at a specific stage of life. So maybe they've just hit 40, for example, or like, their parents had a bit of a scare and they're kind of like starting to think longer term about their health. So a lot of it is understanding, where am I for risk factors like diabetes and cardiovascular disease. And that's something that is obviously kind of important for anyone to understand, I believe. And that kind of continues. I think after that, lots of the insights that people find most valuable are kind of deep ones, and the things that more can help you feel better today. And a lot of that is, lots of what we do isn't just avoiding you dying in 40 years. It's kind of, how can I feel better tomorrow? How can I sleep better? How can I just feel, have more energy? So lots of that stuff is, like various vitamins and minerals, like simple things like vitamin D, like, we're probably, most of us here we're in summer at the moment, so not quite as much, but most of the time we will be deficient. Like, it's just simple as that. Like, unfortunately, we just don't get enough sun. And that can have some nasty impacts that people don't appreciate. And it's a really simple fix, but unless you measure and understand that, then you don't know. So a lot of it is about kind of improving supplement regimes and stuff like that. A lot of it is about kind of understanding exercise and how that's having a kind of positive or negative impact. So yeah, a wide range of things, but I think big kind of risk factors, for a lot of people is really important.
On the fundraising side, at what point did you fundraise? And then I'm guessing in the product you are in, it probably was difficult.
Yeah.
So what was the journey there?
Fundraising was, I'm very glad we're not planning to fundraise again. It was, so we started fundraising in 2015, and we were fortunate to raise a kind of pre-seed round, like pretty much immediately before we'd even launch, which allowed us to at least kind of get off the ground. But kind of raising our next round and kind of a bigger round and then our Series A was a lot more difficult. I think people that, again, it feels more obvious today when you get all these companies, especially in the US, kind of popping up and kind of household names. Function Health is, grown up. So this just wasn't the case at the time. And like people, investors felt, yes, health is a big market, but kind of consumer is really hard. And like, how are you going to make this work? There's huge barriers to entry with the products. It's not that cheap. People aren't doing this. Like, are there that many people that would even want to do this? So it was really hard to kind of help them paint the picture of the future. So yeah, we met a lot of people, got a lot of no's, but enough yeses that we raised them here today.
What's your piece of advice there? What would you advise people, if they're fundraising, on, is it to get a lot of no's and refine the message? Is it, what's your insight for the people that raise now?
I think it's really contextual, and it depends. Like if you've got for some people, the advice is going to be, well, just choose the person you like the most and kind of like that you really vibe with and has a thesis that aligns with your thing. And that's a luxury to be able to do that. for a lot of people, if you're early or kind of like challenged, sometimes it is just, you've got to play the numbers game, and like you shouldn't make trade-offs to who you're going to work with. But there are a lot of investors, but I do think, the thing that we learned and the thing that we hopefully got better at over time was kind of not focusing as much on today and focusing much more on like 5-10 years time. I think almost kind of trying to steer the conversation away from the fact that you have to kind of like bleed into a tube and like these things, and just like really paint that future, which is kind of generic advice, right? You would always be doing that when you're fundraising. But I think in particular where there's, you're early in the market, it's nascent, and you're trying to kind of help them understand what that big pitch could look like. That's so key.
And what's the situation of the company once COVID hit?
So COVID was the fastest I have ever learned in my life. And it's really interesting because of that, because obviously it was a terrible time for a huge amount of people and for a lot of reasons. And I was kind of, experienced a lot of that, but also just an amazing time for kind of what we were doing. And we were fortunate when COVID hit, we felt that, we can hopefully help here. Like, we are in a unique position. We are remote diagnostics. We kind of have lots of this infrastructure in place for the UK. And we kind of, through a couple of connections through the boards, got in touch. We ended up like in number 10, like in a Cobra meeting. It was pretty crazy. And, like no one really knew what to do. But they did think that kind of testing and remote testing obviously was going to be a really important part of that. And we, through various conversations and kind of with a lot of luck and grit, this was something that me and my co-founders were like, there's no way we are going to, basically there was a kind of, they were formulating a big tender to go out for a nationwide testing program to kind of help with COVID. And we thought, like, there's no way, we're up against like massive people, like we're never going to win this, but like, it feels crazy that we shouldn't put, like, we really think we could do this best. And we really think we have the opportunity to do that and actually help. So we were kind of doing it off to the side, and like, week by week, it got more likely and more likely. And then kind of ultimately we won that, and it kind of took the business in a crazy direction, like just one day. So we went from, a startup that was growing and kind of doing some testing to overnight, felt like overnight, having to do 10,000 tests a day across the UK for kind of COVID antibody testing, like build up a load of hardware, go through like assurance, like super fast from the technical side and like clinical side.
How do you source all these kits during that time?
Well, so that was why we were in a slightly unique position, because we already had all the relationships, we had the supply chain. So we weren't starting from zero. We had to obviously ramp up like really quickly, but a lot of the relationships with distributors and the kind of, it's worth saying with Thriva, we are end to end. So like we build logistics software with our kind of like warehouses that kind of store these things, so they're kind of all traceable and tagged. Like we integrate with kind of fulfillment partners, like we're in a really close way. So we had this end to end, and that was why ultimately, we won, because they could just go with us. And then because we won that through the government, we got preferential kind of rights to on distribution for certain components and stuff. They had some relationships that we could use, which obviously helped. But yeah, it was a crazy time and learned a huge amount. And I think, that's where I think also obviously hugely helps with the kind of market awareness. Just this was a thing that you could do at home, and that it was accurate and kind of it would work. And at the same time, our kind of like consumer business was also growing in at that time.
At what time frame is the B2B product coming into play?
So we kind of look back on our very first like pitch deck the other day, and we had had very clear in our strategy, start with B2C, kind of to prove out that this was a thing, kind of really understand the customer, kind of focus on UX and build a great product, and then kind of like leverage the kind of we took a very platform approach, like allow partners to kind of use that. And we kind of had that in the back of our heads, and it was always it never feels like the right time. Like we're so busy with kind of just the kind of core consumer product. And then after COVID, we like looked at those reasons, like why did we win that contract? Like what was it about? Like they had on paper, maybe much bigger, better suited kind of players for this. And when we kind of dug into that was when we took the decision to like, okay, we understood the reasons why we have like solved lots of the problems that are really tricky for people to solve otherwise with end-to-end testing, be that kind of public sector or private. In that, you have to work with various different partners. There's all sorts of like clinical governance in this thing. We've got to think about, we have software medical devices that monitor for like out of range results and kind of like manage them. We have all these kind of things under the surface that people might not realize. And we really realized that was solving a problem for a lot of people. And so that's kind of when we launched our B2B efforts. So we work with the NHS and Department of Health, but also kind of clinical research and clinical trials. And
can you go into specific? How do you work with NHS for these products?
Yeah, so we essentially are they integrate with our API and kind of we handle end-to-end remote diagnostics. So one of the things that we're doing at the moment is if you're over 40 in the UK, you're eligible for a health check. Which is a kind of a test you can go get via your GP, and they'll kind of take some blood and do a few things and give you that. And the uptake for that was really poor, and that's kind of one of the only things really in the preventive kind of landscape for the NHS at the time. And the uptake was really poor. There was poor awareness, poor kind of uptake, and people kind of didn't tend to come back either. So they looked to move that remote, and so that's kind of something that we're powering at the moment. Actually, that's just launched as a pilot and is hopefully rolling out kind of sooner as well. So that's the kind of thing we do, and work with the Department of Health on like various different kind of research bodies. So the ONS, Office of National Statistics, on kind of something called Virus Watch, where they're monitoring virus kind of post-COVID in various different parts of the UK. So a variety of things, but ultimately it always comes down to like seamless, easy, reliable end-to-end diagnostics.
I mean, partnering with these folks, like, I know so many folks in the UK that speak that they try to sell to the NHS and nobody can sell to the NHS. What's your advice? What were your learnings there?
Yeah, don't do it. That would still be my advice to myself like now as well. Like, I think we got incredibly fortunate in a few ways, and we had various kind of forays to trying to work with the NHS that we gave up on. And like, we had some very smart folks on our advisory boards who were very plugged in, ex-health minister who said, don't try to do this. And at the time, a lot of it was funding. The funding is just not there, like, which was true. And obviously kind of is still a huge challenge. And it's just, the landscape is so difficult. And I don't know, people saw this, like NHS England changing and the kind of structure of the Department of Health at the moment, like things in flux all the time. And it's really, really hard to navigate. You think kind of as a startup, navigating a big kind of corporate is difficult. This is a whole nother ballgame. And so I think the advice would be, if people really want to do it, is really find one or two people that are the key person in that space and just get a pilot live, just get some proof point, just do whatever. It could be 2 people. Don't try and kind of like go for the end goal straight away. Just find the right person and work with them to just get something live in some capacity, because it's those kind of proof points and momentum that is kind of essential for anything that comes later.
I remember seeing Thriva everywhere. It just so happens. What can we learn about customer acquisition from the B2C side? Yeah, so
that's our growth and marketing team is incredible, and we've always had that's always been a kind of real core strength of ours, I think, at Thriva, and is obviously really important. I think the key takeaways and the key things we've learned is you just got to constantly iterate. It's a bit of a cliche thing to say, especially from a kind of product perspective, but it's just so true, especially because what works today probably isn't going to work in a month. So you just constantly got to reinvent kind of what you're doing. I think as well, one of the real things that we've been working on over time, like a huge amount of our growth early days came from kind of Meta. So at that time, Facebook ads, and it's expensive. It's not a great way to grow. The CAC's really high for most people. I don't know anyone who manages kind of, small CACs on Facebook. So really thinking about how you can build other channels, especially as much organic as you can, as much as you own, really focus on brand as well. I think brand is one that, we've invested a lot more into over the last 3 years. And the challenge as a startup is you don't see the payoff straight away. And it feels like kind of sometimes good money after bad. And then by brand, that could be anything. It could be, first of all, thinking, what is your brand? What are we to the world? How do people in the pub, what do they say about you? That's kind of what brand is. And kind of, through owned media and things like putting out great content, stuff like that kind of accumulates and is really important, has been really important for us. And then there's some things that we did that I would not do again. Did a lot of stunts, which is super fun, but stupid. We had a guy called, I can't remember his name now, but we basically got the guy who had the smallest penis in the UK. And he'd written a book called The Small Penis Bible. And then we got a massive billboards everywhere with him saying there's nothing wrong with a small prick. And I tell you what, it didn't work at all. What it did work for was the agency we worked with got like all the plaudits. They were like, loads of awards, but it didn't anything. Yeah, it's all over their website. But yeah, so I would say, and I'm sure, there have been examples of that where I know it has worked really well. But I think especially as a startup doing kind of, the reason that wasn't good is because it was a big chunk of time and effort and money into one thing. And any one thing has a small chance of working. So like really do a lot of stuff, build the systems, kind of iterate very quickly. And I guess lastly, from an user acquisition point of view, like really think about what message you're putting out there. There's I think sometimes a dissonance between saying what works and like you find yourself in a position where it's like, this isn't really what we think about as our product. And that can get you into really sticky waters where you might be great at acquiring people, but no one sticks around, or like you haven't got the right customer. They're not your best customer. So I think sometimes really thinking about like, who are our best customers? And you should be speaking to customers also once you have them to understand that. What is the message that's going to really resonate with them, and like really focusing on that. Not necessarily always the stuff that works. Cause for us, we brought in a lot of people that wanted a specific test for whatever reason. And we did a great job. They had the test and they went off and they never came back. And, they were probably happy, but we weren't happy. Like that's not our ideal customer. So really thinking about the messaging and not what just works for the acquisition, but kind of what's going to bring you the best long-term customer too.
I've seen lately, it's either LabCorp or Quest in the States that they launch their own API and they launch their own consumer product. And it makes me wonder, in 5 to 10 years, what's your opinion of what's happening? Is it going to be that there is going to be labs that go direct to consumers, or is it going to be companies like Thriva just going full stack?
Yeah, really interesting question. So I think if I had to choose from the two, I think it's going to be the former. We've spoken to Quest, LabCorp, we've spoken to every big lab group, and what you've identified that is very true is that they are seeing this wave in consumer and thinking like, how do we get a piece of this pie? Like, obviously they're happy in one sense that they sit at the bottom of the supply chain. So like, it's going to come to them if they can win a business, but they want to come up on that. I think they're just running a lab is just a very, very different business. What we don't think of ourselves as a blood testing company. It's a really, really important part of like how we get the data to do what we do, but it's, we're not testing. Whereas, you run a lab versus kind of trying to build a preventative digital healthcare product. It's like completely different things. And so I think lots of the labs are going to do it and are doing it, as you say. How successful that will be, I think, kind of remains to be seen. And I think strong partnerships, maybe strong acquisitions potentially is more likely. I think we have also looked at building or buying our own lab. And that's why I know it's not a thing to take on lightly. There's a lot for us that would just completely take away a portion from a focus from our core business. It's just completely different set of things you've got to think about. And so I think, you have to be quite a serious scale where that makes sense. And that's why we haven't seen, very few of the even, big players who are doing some kind of testing have gone that route.
When I went from a finger prick to Tasso, it was a mind-blowing experience. I don't know if you have the same experience, but I don't feel anything anytime I use it, and it's just seamless. Was this like when you introduced this? Was there a meaningful change? Would you say?
Yeah. So just for context, for those that I don't know. So originally, Thriva and kind of all testing companies up until recently, you were kind of using a lancet and pricking your finger, kind of manually, and like having to drip it into a tube, which is not, once you've done it a few times, you can get the knack of it, and it's like you feel it, but it's not super painful. And so, it wasn't a huge problem. And like we did millions of those during COVID. So, clearly people can do this, but it did put a lot of people off as well. And ultimately, it's just not nice. It's not a fun thing. And then Tasso is a product, where it's basically technically like a mechanical leech, but like you put it on your arm, it's like a tiny incision and then a vacuum, and it kind of draws the blood automatically. You can just like make breakfast while you're doing it. And it is, as you say, completely painless. Like you literally can't feel it, and a few minutes just pop off the tube and done. And that was a big change for us. Yeah. And to put it into context, we've been working with them since 2017. And the product's only just come to market. And there's a few companies doing this kind of thing. And they were just like, iterations and iterations in FDA and CE marking, and just like loads and loads of challenges. And so finally we're here, and it's made a big difference. And I think, I don't know, it'd be actually really helpful, like show of hands, like genuinely, who thinks they would never use a product if it was like the finger prick? Like how many of you would that just put off from using it? Yeah. I think that's, so I'd guess that's like 30-40%, which is kind of, you know, our estimates for like what part of the market are we just missing? People that might want to use this product, but just like that part of the experience is just putting them off. And we saw that. So when we introduced Tasso, our acquisition kind of grew a lot, which is great. But also things like, you know, it improved failure rate. There is a certain amount of just physical stuff goes wrong. People don't get enough blood. They don't do it quite right, or the post is slow, or like that obviously kind of impacts Tasso as well. But so yeah, people getting better experience because they're doing it. It's a completely painless thing, done a few minutes. They're getting all their results and not having to deal with these things. It's just easier for the customer. So that's been a huge change for us, and something we there's still lots of improvements we can make on that process. It's still not where we want it to be, and we will continue to do that. And we work very closely with kind of Tasso to help them improve the product. But yeah, it's been a real improvement.
How do you deal with all of these logistical problems? Being temperature change where someone sent a test, or be it it's just delays from, I don't know, Royal Mail or something. How do you deal with that?
Yeah, it's a challenge. I think, you know, working especially in a technology company where you're dealing with a lot of, like, often you think of technology platforms and it's all ones and zeros and it's pretty reliable, right? Like there's not, you know, things go wrong, but like you kind of understand it's within your control more. When it's physical, like everything can go wrong. We've like any kind of issue like you can think of, like we've experienced it. And like some crazy ones as well, like dogs eating stuff, like people posting, coming to the office, like all sorts. So I think there's probably kind of a few different things. One, building the best systems you can to control as much as possible, or at least kind of provide a great experience around that. Because ultimately what we want to avoid is like a poor customer experience because any of these things. So as far as you can do, build great systems, and that could be like processes, operational, customer support, technology, whatever that is, to kind of minimize the chance of it happening, or if it does, kind of improve what happens. I think the second is just kind of like working on things that can reduce that, like things like Tasso, for example. We have different systems in place, like kind of with suppliers, we have to integrate like various different suppliers. So building as much, this is kind of, you know, not the kind of thing that most tech companies think about, but building as much redundancy into the supply chain as you can. We're constantly having to like swap out certain components and do things, which again is really painful as a startup because you're spending time and money on something that, you know, might not ever happen, but kind of doing those things is really, really important. And then I think, yeah, the great kind of customer support and thinking about the end-to-end experience, like it's really basic stuff, but just like when it's hot, we tell people not to send their sample in. And we're fortunate in the UK that it rarely gets kind of hot enough for that to make a difference, but just like trying to really think about the whole thing as service design and making sure that you're thinking about how to contact the customer at the right time and do the right things.
Mm. If the journey started in 2015 until today, like what have you seen changing in the industry? And then what do you see happening in the next 10 years?
Yeah, so a huge amount's changed in the last 10 years. I'd say a huge amount's changed not even since COVID, in the last like 2 years. Like I think it just feels very, very different to how it did even 2-3 years ago. And I think there's so much more awareness as this is a thing. And by this, I mean, you know, Brian Johnson is probably a name that lots of people here know. Like if Brian Johnson had like, or someone like that has kind of been doing what he was doing 10 years ago, I think people would have thought it was crazy and probably not paid attention. Like, I think there's just much more kind of awareness and desire for kind of understanding more about ourselves, you know, and that applies to not just health, but everything. I previously kind of had a fintech company before this, and we see a lot of the same things. Like there was a time where it was table stakes for banks could just have a crap product and like get away with it, right? Like, and everyone just had to lump it. And like, if you look at the products you use today, I'm sure they're all a hell of a lot better. And I think the same has happened over the kind of last few years with health as well. Kind of health was a thing that you don't want to think about. It's like sterile clinical thing that you want to avoid. And now people are proactively engaging with stuff. And whether that's through things like wearables or kind of like through Zoe or like all these kind of products and companies have launched, and just really shows that people have a hunger and a desire for understanding more about themselves, but also kind of engaging in health with products that kind of in the way that they do in any other area of their life and like having a great experience. So I think that's been the kind of change we've seen in the last few years. I think what I'd hope to see over the next 10 years is where, kind of similar to the conversation you're having before, like data can be taken to like the next level. I think there's a real dearth of health data. Like there's not, like, especially when you think about longitudinal, knowing what we know about our bodies, there's really nothing. Like Thriva's data set is pretty unique in that sense. You know, you have UK Biobank and some other kind of things like that. But other than that, there's not really a longitudinal data set from healthy population. And so I think what we're going to be able to do with that data and like what the industry as a whole will be able to do with the data, especially, again, it's kind of conversation earlier, bringing these things together can be really, really powerful. And I think what that ultimately ends up with is a huge amount more personalization. So, you know, for everything from how we prescribe medicine, which is very generic today, like we're getting some level of personalization to that, but it's still hugely generic and often very kind of based on like biased data and studies, all the way through to just like, what do I do today to like better my health? Like, should I be kind of eating in a certain way? Should I be working out in a certain way? Kind of how is my sleep impacting kind of my health, and tying all these things together? I think I'd hope that in 10 years time, it'll be a kind of completely different landscape of how we're able to do that personally, and all have like an amazing functional health coach in our pocket.
And as a technologist, I can't avoid asking you about AI. What do you think is going to happen?
So I spend more time than I care to admit, like kind of ingesting any information I can get from all the kind of greatest minds. I think the real answer is no one knows. I think, you can pick out lots of the foremost experts and they'll have very different opinions. So I think kind of that is the caveat to everything we say. I think, and I personally change my kind of model on what I think is going to happen over the next 10 years, kind of feels like a month at the moment. I think we've reached a stage where the kind of the foundational kind of, and specifically, I think when most people talk about AI these days, they kind of mean large language models. And I think foundational models have got to a place which is pretty incredible in a very short space of time. When you wind back a few years, we take it for granted, lots of the kind of improvements now when you're on an exponential curve. But I think what needs to catch up is the utility and the products. And I think that's going to take a bit of time. And I think, especially for kind of consumer apps, and we were talking about it earlier, like every app has just stuck a thin layer on top of a foundational model in their app with like a tiny bit of context, and it's like a coach. And anyone can do that. And I think kind of there is a lot of people jumping on the bandwagon, but in my experience, at least, I haven't seen a lot of stuff that is super valuable and just like stuff that you really couldn't be done in the same way, like without in a different approach before. So I think we're going to have a few years of just hopefully products catching up with where the underlying technology is. And I hope that also means some kind of consolidation in tooling and stuff like that. Talking about MCP, and we internally have like a little MCP on the set of tools that we kind of use for Thriva, and regulators aren't happy with us releasing that just yet. But we kind of use that internally, and it does really cool stuff, but it needs a lot of work. Like I certainly wouldn't want to put it in people's hands today. So I think, that in my view, we're going to take a bit of time to catch up in terms of the health, especially, but other areas too, in terms of where the products and the utility is.
With that, do you guys have questions?
You think about genetics?
We have, yes. And I guess one of the reasons why we haven't done it is because one of the core principles of Thriva should be that you can make a change on this stuff. For the large part, you can talk about epigenomics and stuff like that, and the kind of other things. But for the large part, your genes are your genes, and it's kind of useful information. Some of it's useful information. 23 telling me I had like 23andMe telling me I have blue eyes, and they're not. It's like I can look in the mirror for that one. But I think, and there is some interesting stuff you can do with the combination of data, but lots of the kind of genomic data might tell you have a certain predisposition for, say, like high cholesterol, but we can help you understand that, like what it actually is. And so we're trying to focus on things that you can kind of impact, and things that you can kind of make changes about. But that's not to say that I don't think that there is like some value in kind of bringing those things together in some interesting ways. But it's not the kind of core of what we do.
So in the past, let's say years that you might have noticed this kind of pop consciousness was in the religious kind of thing.
Mm.
Have you noticed a change in that? Like, are more people from middle class or lower class just kind of indulging in product?
It's a really good question. And yes, and that's been one of the most, kind of positive things to see from my point of view. And not just, I think there's kind of two dimensions on it, right? There's this, the raising awareness, like it ties raising all ships. And I've seen, maybe it's just I'm getting older, but like lots of my friends and kind of who would never even thought about doing this stuff like 10 years ago, all like messaging me for discounts and like kind of getting involved. And I think so there's just the kind of awareness, which is therefore kind of like, it's hitting more people. And I think that's why it's really important. That's why one of the things we continue to do is, we don't want to be a £5,000 product. Like, and there are lots of very, very expensive, if you want to spend a lot of money, you can know everything about yourself, like quite easily. There are companies that will do that. It's not what we want to do, because ultimately kind of, we want to help as many people as possible. I genuinely mean that. It sounds a bit trite, but, kind of reaching a lot of people. So yeah, we absolutely have seen that, but it's still quite a luxury today. And that's one of the reasons why we're so excited to do kind of work with the NHS, for example, and things like that, because that kind of distribution and the funded model, we have so much confidence in how that will save money for like, not just the NHS, but any healthcare system that did this. Like if you get some false positives and more people maybe going for a GP appointment than were before because they've learned something that otherwise they wouldn't have done, I can guarantee you that saves money from the cost of diabetes treatment down the line. The problem is we just don't have that. We're not able to link up that economic data today. So it's really, really hard to do. So yeah, we definitely have seen that, really positive about it, but there's a long way to go, I think, before this is just kind of something that we just take for granted.
Seems like one of the biggest difficulties is how to disambiguate the casting this big like force back. Like, how challenging would it be to have embedded TriScale? And that's a for you.
Yeah, it's quite hard. Is the answer no? So there are products today, like there are kind of cartridge based products. There are a few challenges to that kind of thing. One, they're expensive, but obviously the price could come down. Two, they're usually you can't get the breadth of tests that you need. So a lot of them, you just can't run the kind of tests. And the analyzers that we run a test on are like state of the art Roche, like multi-million-pound things. Like it's just tried and tested, like very, very good technology to recreate that level of accuracy and reliability in a kind of home device is a long way off, unfortunately. So yeah, it would be great. I'm with you. But unfortunately it's kind of not a reality, unless you're Elizabeth Holmes.
Fair enough. I'm wondering how you after like how to navigate making the product empowering as opposed to anxiety usage.
Yeah.
In like, if you go to your industry, it's high and you can be nudged in the direction of doing it again. But if you're happy, it's like getting worse. Especially if not when you have like an issue, but obviously you want to alert the user, but more like you could work on more, or like you could drink a bit less. How you make that, empowering as opposed to kind of like a constant weight from your shoulder.
Yes, that's such a good question and such an important question. So there's a few different ways. One thing that we do is not sugarcoat it. Like if something's bad, we're going to tell you it's bad. Like we're going to treat you like an adult. You pay for a product. We're not going to try and tell you, no, it's fine. Like you don't like, we're going to tell you realistically, this could mean this, or, it might not mean this. But what we do on the back of that is then really, really important. One, it's the understanding and really selling the idea that the whole point of this is preventative. So if you've got a Thriva result that's kind of not good, it's okay. Like there's something you can do about that because it's a thing that we test that we know you can do something about, and that you are tracking this over time and you've got time to do this. So helping people to understand this is something they should engage with early, and don't let that anxiety kind of put you off until it's kind of much later and much harder. It's really important. And then lastly, I think it's just having good advice. I think we could have a product that just gave you your data and that was it. And like, see you later, like go to ChatGPT, which is what a lot of people will do, I'm sure, like kind of just throw you into the healthcare system when suddenly that like maybe the reason you're here is because it's really inaccessible. It's like, I can't get an appointment for 6 weeks. So I think it's, we take responsibility for like what you can do next and make sure that we're supporting on that. And that can be, through the products, through lots of the kind of information and kind of next steps and automated like advice that you can get as well. We have some kind of quite advanced like things that will give you specific things that we know are going to change that thing because it's worked for people like you. All the way through to, we have people now and again jump on the call with our clinical team and like one of our doctors will just like chat to them, and we kind of have some productization around that as well. But I think it's just, we very much feel that doing those things, you're never going to completely avoid anxiety, and some people get more anxious than others. But in our opinion, it's much better to know and then try and do something about it than kind of not know and find out later.
You ever formally wake up a sort of family who needs big side thing? So we got the business for funds, and the blood testing would truly out that people really for. So we'd love people to movies nowhere. We also get blood testing data out, taken out maybe we actually use some OCR.
Yeah.
It's serious.
Yeah.
Do you have something in mind? Is
planned and built. Yes, it's working today. So we should chat. We power Superdrug today, end-to-end white label testing. So we have an API that kind of partners can use for our platform to kind of request, and we manage the entire process, and that can be white label kits. So it can be kind of branded for them. We will have like white label results interfaces or an API to kind of pull those out and work with in products. So we provide that today, and pharmacies when we work with a few pharmacies on exactly that kind of thing.
Getting to one of the better things that truly did this accelerate and just that. What would you say nowadays, like trying to candidates getting just practice them getting NHS that prepare more?
Yeah. I mean, so first of all, I will admit that I was on Claude yesterday, reminding myself of some acronyms for what various different things mean in the NHS, and it's really complicated. There's no two ways about it. So kind of mentioned a few things. I think that it really depends on the kind of product you're working with, but I think finding the person that is forward thinking and is willing to innovate, is as important as anything else. The person that is kind of able to and will sponsor whatever you're trying to do. That's step one. And you often find those people share a lot of the same pains, and they're kind of willing to work with people who are trying to innovate to kind of make stuff happen, and obviously are in a position to know how to navigate that a bit better. I think I'd really hope that with a lot of the 10-year plan was just announced last week, which was really interesting. And there's a lot of stuff around innovation and kind of NHS app and digitization, stuff like that. It will take a bit of time. These things always do. 10 years is not a long time in NHS land. But I think the kind of the appreciation for the need for broad brush innovation and kind of working with private sector, I think has increased. In my opinion, there used to be a time when any private company working with the NHS is it's the privatization of the NHS. And in my mind, that's such a shame, because that is essential to kind of help the NHS grow and thrive and kind of do what it was ultimately, initially intended to do, which is treat sick people. So I think you're right. It's not easy, but I think finding the right people, and kind of, as I said, just doing whatever you can to get a pilot of any size live is kind of absolutely key, rather than just trying to think kind of what is the end game here. Yeah. So there's, as kind of you talked about, a lot of the time when you get a set of results, it's just a PDF with some unintelligible numbers, right? And the doctor understands that, and what they're looking for is the one that's red, and they will probably kind of ignore the rest. And that's true. And that's no bad thing for GPs. That's just what they are doing with a blood test that is different. So what we do with our labs is we take the kind of raw format that comes out of their LIMS system, as it's called, which is a kind of format called HL7 or FHIR. There's a few different things, and it's the most crazy standard in the world. So we've had people ask to license just the bit of our technology that does that, because it's horrible, but it's really important. So we have a lot of technology just doing that to make sure there's consistency, that there's not unexpected stuff. Early on, when we built the system, we notified our labs that something had changed. And they're like, or it was wrong, sorry. And they were like, oh, wow, yeah, we've had that for 8 years. And they're like, no one noticed. So it just goes to show you that kind of thing. So that's the first step. We take the rawest form of the data and we kind of do what we need to do to kind of make it reliable, consistent, structure it and store it in the right way so that we can kind of do all the stuff from there on.
Thank you for sharing this, Tom. So I'm interested to know about the end-to-end aspect of either. You mentioned the logistics software. Can you just tell us a bit more about what you mean by that?
Yeah, sure. So end to end means from ordering a test to getting a set of results. If you are a user and a partner, person A wants this set of tests, we will take care of everything else to the point that where they get the results. And obviously for remote diagnostics, there's a lot that goes into that journey. So on the, first of all, what happens if we receive an order, we've got to send the right kits out with the right components, and that could be a variety of different things, or even schedule a nurse to come to you and take a sample, which we also can do. And just to answer your question specifically on the logistics software, for example, a lot of tests that you might order today, you'll get a code and you'll have to go enter it. And that's because it's just off the shelf. They picked a SKU and sent it to your home, and it's unregistered. It's not linked to you in any way. That's a huge problem. That 20% of people not doing that properly. So we built a actually pattern bending system it seems really simple if you're a technologist, but it's and it is relatively simple, but no one's doing it. To link at the point of fulfillment, link that to you. It's in our system. So our fulfillment center is using our software to then scan that, and it's linked back so that when you get the kit, you just take the test and send it off. You don't have to register anything. If you haven't, there's not a problem because it's gone and we can't guarantee that's your test. We can't link it. So it's little things like that we do that make a real difference. And actually for the NHS, for example, they had a PCR testing. So they swab testing before that. And it was the same process where you had to register the kit, and they were seeing 28% of people not doing that, which at scale is a huge problem, right? In COVID, when you're trying to solve that problem. So it's just little things like that, across the entire supply chain and technology stack and everything we're doing. From when we get results back, there are as I say, a clinical governance. It's a medical device that we have that checks all the results, matches them for any escalations based on what we know about you. And if there's something that needs to be followed up on, one of our clinical team will handle that, and it's escalated. So it's all these things. So the software is very much not just the testing and the results presentation data itself. It's everything that goes into that.
I was curious, would you look at the action suggest that you get steady, a recommendation users, how much of them are lifestyle related as opposed to, supplements and nutrition, as opposed to actual medical intervention, you should go into a doctor.
Yeah, a real mix. So we will recommend some people to, basically we are we are CQC registered, so they go Quality Commission. So we can diagnose and provide treatment as a company. We are registered to do that, but we are not set up to do that. So if you have a result that is really concerning and you need urgent care, and we'll tell you to go to your GP or go to hospital. So that will be a small percentage of cases where that will happen. And then sometimes there might be things that we might recommend that you follow up with in your next GP routine appointment. It's not urgent, but if you're seeing them anyway, because we also don't prescribe. So if there's something that you need treatment on the back of that, we don't currently do that. But then for everything else, it's a broad range of lifestyle things, that from the quite general, which is broader brush diet changes, to very specific things like eat this specific nut, because we know that that's going to, for people like you, that's going to work. So and the more data we're getting, the more accurate and better we can do those things over time. But what's really important is we really believe in the right balance of clinical input and just automation. So what we haven't done is just set build a machine learning model, just let it go crazy and just recommend whatever. We have a clinical team actively curating, based on evidence, the right types of things. These are the things that we should do. And then that couples with that technology is we believe much more powerful. But yeah, a huge range of advice for anything from supplements, diet, exercise, lifestyle.
Just to follow up on this question, does it have also a feedback loop where the customer can say, okay, I try to do this, but actually this didn't improve my result?
Yeah, it does. It does. So, we will have, we built something we called health plans. So you can build a structure plan on the things that we recommend, and you can say what you are doing and what you're not doing. And through that, we can obviously tie back to the results if you come back into later. But that's an area where we want to do way more and make it way easier to do the things. What we don't think is the right approach is, I don't know if anyone's tried to do a diet tracker, and I could do it for maybe 2 days, and then I'm not tracking every apple. And it's so we don't want to go that level where you literally having to track everything to make it useful. We want to make it as easy just to So do a weekly check-in on the things that you did do, or those kind of things, and like find that right balance of user experience. There's something you're actually going to kind of do regularly and kind of track. But it will also make that kind of much more useful and for other people as well, like from a population point of view. If we know a person of a certain profile that works for that type of person, then we can recommend that.
Super. Tom, thank you so much.
Brilliant. Thank you so much. Really good.